Hi, it's me again. I was here before, and now I'm back. Although this time I'm really excited because we are going to have a much more lighter conversation than I was having with y'all earlier this morning. As you wrap up your lunches, we're going to continue with our next panel, which is Innovating Access and Stability in Our Community. So our final panel of the day is going to explore how research, community access, frontline response, and technology converge to build a stronger safety net for Tri-County families. Please join me in welcoming our panelists. Ilze Astad is the Chief Innovation Officer at Trident United Way, where she leads strategies that bridge philanthropy, technology, and community impact to advance economic mobility across the Tri-County region. A longtime advocate for food access, workforce, and economic development in our region, her work is driving investments in innovative models, from employer-based assistance to digital referral systems, making community support more accessible, coordinated, and equitable. Natasha Chatman is the Chief Impact Officer at Trident United Way, where she leads initiatives to improve financial stability and remove barriers to opportunity across the Tri-County region. A former Chief Operations Officer at Feder Healthcare Network, she has expanded healthcare access in rural communities and continues to advance equity through leadership roles on local workforce, health, and education boards. Natalie Hauff is the Deputy Director of Innovation at the Charleston County Public Library, where she leads system-wide efforts in community engagement, partnerships, and programming that expand access to resources and opportunity. A Pulitzer Prize-winning journalist turned public service leader, she has spearheaded initiatives in food literacy, digital equity, and workforce development while championing collaboration through regional coalitions and nonprofit boards. And last, Dr. Shelby Shumard is the Director of Research at the Joseph P. Riley Center for Livable Communities at the College of Charleston, where her work centers on public policy, program evaluation, and state and local governance. With experience across nonprofit, private, and government sectors, she brings deep expertise in strategic planning and data analysis and evaluations. Please put your hands together for our panel. All right, so to start things off, I'm going to start with Dr. Shelby. Shelby, your research at the Riley Center looks at systemic barriers facing Alice households. From your perspective, how does research not only help us understand the challenges, but anticipate future needs?
So first of all, a lot of the challenges that we're facing here in the region are not new, right? They've been faced by other regions, and so research provides an opportunity for us to learn from what others have done. What was successful, what was not successful, how can we build on what they've done? But also, research is limited, right, in that we can only study what's been done. And so it also can come alongside as you do new innovation, new strategies, and thinking about how can we both measure progress towards kind of the goals that you want, but also thinking about how we're evaluating more broadly, both in the short run and long run. And so it can also, research can provide some clues on where to adjust and also where we need to continue to invest more resources and time.
So to follow up, I mean, how can nonprofits and other partners better partner with research institutions like the Riley Center?
Mm-hmm. I think often the most common place that we see partnership is around program evaluation or thinking about kind of on the back end or collecting community impact, right? I think one of the really interesting things that we've done with you all is thinking about it from the front end and thinking about how are we going to measure progress throughout this, right? As a researcher, part of my job is essentially figuring out how to tell stories from data, how to make sense of the data, but I'm always going to be limited by what data we have. And so being able to, I think one of the ways in which we've been able to partner with you all and what has felt like a really productive and a bit innovative way is kind of thinking about it on the front end. What do we want to know up front? How is that grounded in what our community cares about? And how can we make sure we're collecting the information we want on the front end so that we can be able to get a sense of where the impact is happening and how we can continue to innovate in the future.
Thanks for that. Natalie, turning to you and the amazing work you're doing at the Charleston County Public Library, we know that the libraries are a trusted space for community members, and you've partnered with Trident United Way to expand the Centers for Strong Families model in both virtual and physical spaces. So how does leveraging a community hub like the library help reduce barriers for families?
So it happens in a lot of different ways, and it not only reduces barriers for families, but for us, it was also a bit of self-preservation as well. So what was happening at Charleston County Public Library, and we are not alone, this is happening in libraries around the US, is that because we're community hubs, patrons are coming into public libraries because they're trusted and they are asking for resources. And these are resources beyond books. Now, we still have books. Hopefully, we have books for a very, very long time. However, it's really broadened to include resources that our library staff are not equipped to handle, nor should they, in our opinion. Now, there are library systems around the country that have successfully taken on social service models, and they have hired social workers. And you know what? We could have done that. We had the resources, we could have trained our staff, given them another duties as assigned, right? But we looked at the landscape in Charleston County and the Tri-County, and we recognized the incredible and passionate organizations that already exist here. So for us, it was a win-win. These organizations, and the Trident United Way being the organization that we partnered with, was already doing this great work, convening all the non-partners, many of which we were already working with. So for us, it was a no-brainer, and it made sense. So we went to Trident United Way and said, our staff are feeling the burnout. They're also feeling that vicarious trauma because they are very empathetic people. They hate when people have to leave the library without an answer. They are the human Google, right? But some information goes beyond just research, and it goes, you have to have that really warm handoff. Again, we were talking about referrals earlier, in order to really make an impact. And so for us, it really made sense to bring Trident United Way into a trusted place like the library and see how we can connect those individuals looking for those resources. And vice versa, we were then able to have Trident United Way share a lot of the resources that we provide. So what's our bread and butter? Literacy, story time, technology literacy, teaching tech classes. Of course, books, yes, that's never going away. But so much more, and workforce development, helping people with their resumes. And so now Trident United Way also gets something out of it where they're able to meet people where they are, but also integrate those services. So for us, it was just an obvious win, and so far it's been about 8 weeks where we've been piloting at Main Library. And we've already helped dozens of families in a pilot fashion. We're not like, spreading the word loudly. This is just organic referrals, and we're already helping people. We have a waiting list already. And so we see it as a good problem to have, which means that more support means more family coaches. And then how do we cascade that out to our 17 other locations? And so that connection, this is just the beginning, and we cannot wait for the future.
Thank you so much for that. And, it brings up an interesting point about how many different places in our community do we have folks who are engaging with community members and trying to have difficult conversations about what resources are available and how they can serve them, maybe in a capacity that they weren't trained on doing. And so I guess my next question is for Natasha, a little bit about these family coaches. We've heard a lot about their role. Can you talk to us a little bit about what these family coaches are seeing? What are the kind of hopes and dreams and struggles that they are working with community members on a day in and day out basis?
Thank you for that, Joey. And I will say that you guys heard a lot of information this morning about the new direction of Trident United Way and how we're really leaning in on how do we support families in the way they need us most. And so one way in which we're doing it is through the resource of a family coach. And so first of all, I want to recognize and give credit to our team, our amazing team within our Centers for Strong Families. They are doing amazing work. Majority of the people that come through our physical doors are individuals that are experiencing crisis. They're in a state of vulnerability, and we're trying to move them to a point of stability. we've done that for a number of years. We've done a great job. They've done an amazing job. So we always say we have a superstar team. So we want to recognize them for the work that they've done. And not only just our team, but just this community, because we've all had a focus on the need for wrapping services around families. But what I will say is what we've learned through this work that we've done, through the research that's been done, that there is such a need to do more. Our communities need more. We sat in those meetings with the Riley Center a few months back and learned that and this is not anything I'm saying, this is what I learned in listening, that there's a significant number of nonprofit organizations that are working to get people from a place of being in crisis, being vulnerable, to being stable. But as we've heard through the ALICE data, that more is needed. The ALICE population, they don't have the benefit of accessing public benefits. Oftentimes the eligibility stops at the various levels around poverty levels, right? But what we learned this morning is that we have to do more, and we're doing more through family coaching. So our family coaches are continuing to do the work that they're doing. However, they're also expanding their support to the ALICE households. And so through the coaching, we are looking to work with individuals more long-term. So like when they come in, our team is working with individuals to create a plan for them, creating those long-term goals. We're working with them over longer periods of time and getting that buy-in from them. We all know all day long, we always know what we want for other people, right? But they have to want it for themselves. And so our team keeps that in front of us and say it's so important to get that buy-in and ensure that we are creating a plan that's gonna work for them. So the family coaching, that's what's new for us. That's what's new for us. That's how we're moving in a new direction so that we can support not only the individuals we've helped over the years, coming in at a state of crisis, or being vulnerable, trying to get them to stability. We now know that we now need to expand our support for the ALICE households, and we're doing that through the family coaching model.
Thank you so much. Well, for nonprofit folks and other folks in the room, who've been around for a couple of years, we recognize that, yes, it's important that we look at the data that comes to us. We connect with community partners, and even the concept of, trying to help provide coaching or case management is nothing new. And so my next question for Ilze is really just to talk to us a little bit about what are you hearing around like technology and the way that can reshape the way nonprofits are serving families.
Is this on?
It is.
It's on. Well, I'm not sure what you've heard, but we have been up to a couple of things at United Way. We are looking at technology and how innovation and AI can help us serve our clients better. And not only that, not only connecting families with services and programs in a rapid manner, also how do we preserve the sanity and of our case managers? Same as librarians at the library, our case managers come to work on a Monday and are greeted by 100 different voicemails on their phone lines. And a lot of times, if we look at technology, that could be automated. A lot of the questions can be grouped together in categories. So what we have been up to quietly has been looking at ways that we can stitch our beloved 211 system with local referral networks, that we can plug in your case management systems. This is vendor agnostic, so come one, come all, and how we can really, we talk about referral loops and closing the loops and have been talking for many years and have not really figured out how to do it. I can now say to this team and to this crowd that we do have a model. We will be moving into proof of concept here shortly in the next 60 to 90 days. We will be deliberate and careful on how we expand and how we roll it out, and definitely get your feedback when time is right. But what this is really doing for us, and back to your question, Joey, it's a major paradigm shift for us. We are ourselves modeling this behavior, and we invite you to do the same, to go from service focus, program focus, to really individual focused delivery system. We talk a lot about holistic services. It's time that we also now started delivering on that.
Thanks so much. Thanks so much, Ilze. Maybe just a follow-up to that, because I know that the term AI is a buzzword a lot that we hear in everyday conversations. Do you want to share a little bit about what excites you the most about what things like AI can unlock for nonprofits, and how do you keep it people-centric?
It's a great and also scary question. So what excites me about AI is AI allowing us humans possibility of being humans again. I really see that this new system will allow to automate the mundane. It will allow to take away the stress. It will certainly take away those 100 voicemails that a case manager gets on Monday morning. It will reduce friction. It will deliver services more expeditiously, and ironically, allow us to be more human and allow us to lean in with each other and provide that humanity and compassion when it's time for intensive services. AI and technology is not intended to automate compassion. It's intended to augment it. There are questions about privacy, data governance, transparency. I can tell you that we are taking all the measures and taking it really seriously from day one to make sure that those components are built in. And simplistically, at the end of the day, this system and this process will deliver services and programs to clients faster, cheaper. It will preserve the humanity of our case managers and hopefully just, again, make this community more vibrant and more stable together.
Thanks so much, Ilze. On the topic of innovation, back to you, Natalie, just curious your thoughts. I know I went to the library the other day and they have a full 3D printing machine in there, which is something as a kid going to the library I would have loved. I'm curious your thoughts on, have you seen many, or what does the future hold in terms of innovations for turning libraries more into community access points and less, just primarily for books?
Well, it's funny you should ask that, because this person sitting next to me is actually helping Charleston County Public Library understand it straight from the community. We can assume as best we can. Obviously, we're experts in our field, and of course, we provide that lens in how we think about how we provide services that we're seeing from the community. But the best way to do it is really go out there and ask. And so that's what the Riley Center is actually doing right now in collecting through focus groups and surveys, really what is the next step for Charleston County Public Library and the needs that they want to see both in our collections, but also our programs. And over the past few years, we've done that through adding non-traditional items. In other communities, you've heard them called Library of Things. And we have everything from blood pressure monitors to passes to your local parks, the aquarium. We've built some great partnerships throughout the community so that we can give that access. We have telescopes. And so there are a myriad of different items, but I really think that is just scratching the surface. Recently heard someone say, hey, what about a litter kit that people can check out? And that could be in partnership with an organization in improving our environmental concerns. And so there's so much though, right? So that's what the Riley Center is helping us figure out is what does our community care most about, and how do we then provide them the tools to do those things? And yes, of course, we have amazing maker spaces and creative studios. And so at several of our locations, we have 3D printers, we have digital access, and a lot of that is tied to workforce development. Yeah, sure. great hobbies to learn, but some of it too can be a building block for employment. So we have a lot of small businesses. They come into the library, and guess what? They may not be able to afford a marketing consultant, but they may be able to use our cameras, our DSLR cameras, to shoot photos or portraits or do a training video. And not only do we provide access to the tools, but we teach them how to use it. And I think that that's the important part. I was fortunate enough to do a TEDx talk a few years ago about the evolution of public libraries. And one of the things that I think really struck a chord was that, if you give a man a fish, he eats for a day, but you teach a man to fish and he eats for a lifetime. And at CCPL, that is where we are centered in enriching people's lives with different tools, different partners, so that they can really meet the maximum potential for their life.
So Shelby, what does that look like when the Riley Center partners with a group to help them think through these challenges? Is it as simple as just calling Shelby up and saying, come on out and run this for us? Or what does it look like? And what expertise do y'all bring to the table?
So it can look as simple as calling up and calling me or calling Kendra, but it is really getting to partner. When we partner with organizations like you all, like Triton United Way, and with CCPL, we really try to understand kind of what are you trying to get at? What are the decisions you're going to need to make? What are the options that you have on the table? And how can we best get that information out? And so doing that through a combined way, so thinking about how we can collect information for wide numbers of people via things like surveys, but also realizing that it's also so valuable to go and talk to people, to hear from people, from a diverse set of people who, right, the libraries in Triton United Way, you all interact with such a wide breadth of people in various different places with various different needs, with various different organizations that both of you all partner with. And so thinking about how we can hear from some of those organizations, you all have different perspectives on what you need or how you would like to partner. And so I give both of these organizations a ton of credit for your willingness and openness to listen, and also to not just listen, but to take in that information and think about how that can inform where you're going. And so that when we hope as kind of the Riley Center that we're often being that partner and trying to help you all use the data, get the data, but also make meaning of it, right? And not just data for data's sake. It's kind of useless. And so, and a lot of organizations often are data rich but information poor. And so often at the Riley Center, we love to come alongside y'all's organizations and think about how can we make that usable? How can we help you make an informed or better informed decision than you could before?
Data rich but information poor. That's deep. The last question is kind of for Ilze and Natasha to talk a little bit with us about how do you see the family coaching model, balancing, addressing urgent crisis needs with families and then helping them build long-term sustainability. How does this model, impact that, and how do we see, innovations in technology assisting in that part?
Thank you, Joey. So I would say for us, and I think I answered this a little bit with my first response, so I apologize that I jumped ahead a bit there. But we anticipate that the family coaching model the family team will continue to work with individuals and assist them when they come through our doors with navigating the resources throughout our community. One thing that I will say that Triton United Way really well over the years is build connections with the community and the nonprofit resources that are out there, and we will continue to do those things and continue to support individuals in navigating that. That is a very amazingly great superpower. But we will also, through the family coach model, look at how can we deepen the impact. So it's not about the number of people that come through our doors, it's how are we making a difference? How are we making their lives different? How are we improving? And we see that being a possibility through building relationships with families, deep relationships with families, working with them on a long-term basis, and basically going alongside them. Ms. Kathy Easley always reminds us, and DJ brought it up in the talk earlier this morning, that it's really important for us not to do things to people. It's important to do things with people. And we feel like this family coaching model that we're transitioning to is going to position us to do things with them. So there's true impact, true change that not only that we're proud of, that they're, as an individual, families proud of as well.
And in terms of system support of this model, I mean, think of it as moving leaner, and I want to say meaner, but that does not apply here, but just really with more vigor. We are looking to cut down on administrative burden, obviously, for case managers and for clients alike. We want to, and this is during our proof of concept, which is obviously very new, and we have some learning goals that we really will focus on in the next 60 days. So administrative burden, one, how long or how fast it takes to deliver assistance from intake to actually receiving the assistance or program or service, looking at how the impact of shared data and what we do with it and how we can use it as a community, as an organization, as with all of you, and what do we do with that and how do we make better decisions. And then we are super, super excited about predictive analytics and aggregate outcomes, and really packaging that information in a way that can be shared with funders and philanthropists and stakeholders and politicians to really, in a transparent way, to show what is working and what's not. So this is not just for us operationalizing our programs internally, but imagine a world where we are approaching funders with confidence, saying, you know what, this did not work because of these factors here, and the data proves that. But we have pivoted, and we have learned from that, and look how well that's working here. I mean, overall, if we can use technology for good, which we obviously are, if we can connect one family to stability, we already are changing the system. Now, if you think about, if we can scale that to the county, to the state, to beyond the state, we are building infrastructure for equity, and we are really building a system of stability that can be scaled like software.
Wow. Leanne, do we have time for questions from the audience? A few questions. If anybody has questions for our amazing panelists up here, please raise your hand, and someone will come to you with a microphone. We'll open up the floor for questions now.
Hey, Renee with Community Health at Roper St. Francis Healthcare. To the panel, I think about the work that United Way has done being that catalyst for change and being a part of that work back since 2009 with some of you. Just the emphasis and feedback you all have about, we talk about collaboration. Natalie, you brought that up. And we're in a microwave generation, and how fast can we get it done? But I think also taking a step back in the value of what we learned over the last decade of the work. You know, when we had the workforce with the community health nurse, we've had so many great markers of success that have led us to where we are today with some of the things that you're highlighting. But I want your feedback on how important that is to take a look back at some of the things we've done, and also that continuous communication that needs to happen in collective impact, which this forum is exemplary of that continuous communication. But how important is that in this process?
I'll take a stab at it. I will say, Renee, since the beginning, I can't see you over the podium. I'm sorry. I'm looking around. I'm like, where are you? So I will say working with the community on this work has been super duper important. And for me, what that means is we're learning from things they've learned over the years. Because like I said, this community has worked together in many different projects in the past, just as you stated. But sitting down, having those meetings, and just having a room full of folks really leaning in and talking about, this is what we've been doing, or we've been talking about this for a number of years, and this is where we are and why, has been really key to us building a foundation to where we're going. And so with the Riley Center actually doing the research, not only taking notes from those conversations and those lessons learned, bumping that up against the data that they've found through research of other entities in other communities that have done similar work. So that has really been the backbone to us figuring out where we are going. And so how important is that? Very important. We love that. That is so key to us moving forward. And in terms of looking at the data and us keeping it before us, I remember when I sat down with Amanda Lawrence when I first got this role, you asked that question, what do you need me to know? How can I be successful in this space? And she talked about the importance of making sure that you keep before us and the community the progress that we're making. And that is what has really driven us with this bold goal of having a shared dashboard that we can show the community as we're working together, this is what we're doing together, and this is how we're making progress. Because if you track it and you keep your eye on it, you'll have progress towards it. So thank you.
And I'll just add that, especially from the partner perspective, I mean, I've been in this community for almost 20 years. I have covered all the initiatives or been part of them. And I truly believe that this is one of the most innovative approaches, even though when you think about it at its simplest form, it's simple in that we're bringing everyone together, but it's recognizing what those needs are, working with those community partners, and then instead of adding that model, which again, Try It United Way could have done, it's bringing all of those nonprofits. And so all together under one roof, and then how do we leverage technology to maximize that? I truly believe that this is learning from the past, and then taking the best parts of that, and then really culminating into something new, yet old. Does that make any sense? It made sense in my head. Okay.
I think it makes sense. I'll also add that United Way has a history of technological innovation over the years as well, right? How many folks know about our 211 call line? You can raise your hand. It's okay. You don't have to be shy. Right, so what started as a phone-based service became a texting also service, which also became a web-based service, and on and on. How many folks have ever heard of the charity tracker system? I know nonprofits in the room definitely have, right? A central place where folks can do case management and connect with other nonprofit needs in an anonymous space, right, to be able to resource share and communicate with one another. So the future of innovation has a long history, as Renee mentioned, with United Way and within our community, and we're very excited to continue that tradition. Any other questions from folks? Yes, right here in the middle.
Thank you. I think this question is probably for Natasha. I'd like to hear a little bit more about our family coaches. What kinds of folks have you been able to recruit and hire into that very important position? What sort of backgrounds do these people come from? And then once hired, does United Way have any sort of training program in place to help them make that transition?
Yes. Thank you so much for that question. We are building as we speak, I will say that. Family coaches, so we recently transitioned over to referring to our team as family coaches, I think, 3 weeks ago? And so prior to that, we referred to our team as family navigators. And so they were tasked with doing the things I spoke of earlier, helping individuals navigate through to resources. And so with this transition, all the things we laid out this morning, we thought it was very fitting to transition to calling our individuals family coaches. And so those individuals are have a background when it comes to family social services. But one of the things that we feel with this new longer-term case management component is that we want them to spend what already are doing a lot of this time with looking at budgets. So it's having some idea of how to establish a budget, how to help individuals navigate through financial spaces. They will continue to do a lot of things that they are doing when it comes to connecting people with resources, but we're also adding a layer on to that financial resiliency piece. We also are looking and And actually, you asked about, is there a training program? We're actually in the process of building that out. I literally was talking to the team Friday. I see you in the back. Looking at the different types of elements that's needed in order for them to support the individual clients. And so we're actually in the process of building that out right now. And so there'll be some level of understanding how to help a family navigate on the financial level, but also we had an idea of having individuals come in and talk about what does it look like to case manage? What does motivational interviewing looks like? What does it look like to help individuals de-escalate certain situations? So we're actually in the process of building it out right now. So it's fun. It is moving and shaking, but it's good stuff, and we're excited about it.
All right, y'all. Well, thank you so much. Once again, let's give a round of applause for our panelists who are here today.